Hey guys, Dr. Mike Risoldi. I'm here to talk to you about neuropathy. Now, neuropathy is affecting like 24 million people in the United States, and there's 3 million new cases of neuropathy every single year. Now, typically people think if you have neuropathy, you have to have diabetes to have neuropathy, but actually it's only about 30% of the people that have neuropathy is actually due to being a diabetic. Actually, there's dozens of causes of neuropathy, and it could be multiple things. In most people's cases, it's a combination of things even. Now, you could be a diabetic. You could actually have side effects from cholesterol medicine or from chemotherapy. You can have peripheral vascular disease. You actually can have stenosis or pinching of a nerve in your back and not feel any back pain, but that can still be compressing the nerves to go down the legs. So here's what we see, unfortunately, when people come in. They have numbness and tingling either in their hands or their feet. They have literally knifing, stabbing pain or like needles in their feet. They lose their balance more often than not. It's a progressive problem, guys, so it's not something that can start out typically with numbness and tingling and then starts progressing to get worse. We see people lose their ability to drive. And unfortunately, the current medical treatment is a couple things. One, it's medicine like gabapentin or Lyrica, which do nothing to address the underlying cause of why you have neuropathy. And unfortunately, they have side effects. So we're not suggesting that you start or stop any medicine, but none of those medicines given for neuropathy address the cause of the problem, and the condition, unfortunately, gets worse. So here's what we do. We try to actually get down to the cause of why you're having a neuropathy in the first place. And that could be multiple things. So there's 5 main things that we do. One is called light therapy. So that's actually a boot that you would wear, and it actually causes angiogenesis or new blood vessels to grow to the nerve and getting that blood supply back to the nerve. We do something called electrotherapy with a machine called a rebuilder. It was designed by the American Cancer Institute to help people that have neuropathy due to chemotherapy, and that actually regenerates and rebuilds the nerves in your feet. We do nutritional therapy that brings inflammation down in the body and actually helps to balance out your blood sugars. So we see people that are diabetics really lessen the need for some of their medicine and really lose weight and start getting healthier. We do specific chiropractic adjustments to get the pressure off the nerves so the brain can communicate not only to the organs but to the nerves that go down to the extremities. We do balance therapy, so we help you stand on a vibrational plate with weights on the body that actually retrain the body to get balanced again. So all these things are designed to really figure out why you have neuropathy and get down to the cause. Now, we don't accept every single person that comes in, and everyone's not a candidate for what we do, but if you are, after doing an examination, we do a 16-point evaluation to see how much sensory neuro loss you have in your hands or your feet, and then we do specific spinal x-rays to see if we can help. If you're interested in coming to a complimentary dinner, we actually are having a dinner with the doc specifically on neuropathy and for our neuropathy patients, just to find out if they're a candidate for the procedures that we do. If you're interested, just click on the link below, and one of my team will give you guys a call and get your dinner reservation for that dinner. Look forward to seeing you guys.